everybody has a right to accept, different treatments, different medications, but I just want it to be from an educated place. So I always ask my patients if they know why they're refusing something, because I think that's important to know, right? What's the patient's why? And if they don't have a why, maybe you can help them. Like, hey, let me explain it just a little bit more. So that's the first thing I wanted to say. And the second thing is just there's this, I don't know, barrier between nurses and patients these days, where I keep seeing patients who I don't know if they're scared of the nurses or what it is, but they feel like they know more just because they've seen some things on social media. So just because you've seen a couple moms say it on social media doesn't mean that it's necessarily true. Always fact check things with your doctors, midwives, or your nurses in the hospital. And don't be afraid to ask us. Ask us questions that you have. Hey, I heard this on social media. Do you think it's true? Rather than, I heard this on social media and I don't want to do that, and that's that. So just make sure it's coming from an educated background when you are choosing to refuse or to want something as well. So that's all I wanted to say today, guys. I just feel like each time I get here on social media, I'm seeing more and more moms saying, oh, make sure you don't do that, or make sure you do that. And social media is a good and a bad thing, right? Because yes, we're getting more and more information about stuff that maybe if you didn't pick up a book and read it all, maybe you wouldn't have heard that before. So yes, you're getting more information, but two, it can also be wrong sometimes. So just make sure you are educating yourself in the best way. Which leads me to, if you want a childbirth education class, don't hesitate to check mine out. You can get it at Gumroad, GUMROAD.com/babybumplife. And you can find my childbirth education class there. My class is about a 2-hour class that you get. Once you buy it, it's yours. It's me talking over a PowerPoint that I did, and it comes from a nurse's perspective on things. So I've taught childbirth for a long time. I've been a nurse for 16 years. Feel free to check that out, guys. And if you have any questions, please feel free to send me a message and let me know. Have a good day.